Thank you for joining us here this afternoon. As you may be aware, President Obama will be sending a request for emergency funding to combat the Zika outbreak. And the Centers for Disease Control just a few days ago opened its Emergency Operations Center at Level 1 to prepare and mitigate for the Zika risk. So this afternoon, I did sign an emergency proclamation here for the state of Hawaii so that the state can be prepared to fight mosquito-borne diseases statewide in Hawaii. I did want to reassure that there has not been a Zika case locally transmitted here in Hawaii. We are doing everything we can to be prepared, to be proactive, to prevent vector-borne diseases here in Hawaii. Hawaii Emergency Management Agency will be working with all the county mayors and the county civil defense coordinators to ensure that statewide we are ahead of the game and proactive in responding to vector-borne diseases. This emergency proclamation does a couple things. It does provide access to the major disaster fund that will provide additional resources to the department. It authorizes the Director of Health to take any and all measures necessary to contain outbreak of mosquito-borne diseases. It suspends statutes and regulations to contain the outbreak and suspends provisions of the procurement code to allow us to take appropriate action. It directs all state agencies and officers to cooperate to extend their services, materials, and facilities as may be required. And again, it can be extended as needed. Dr. Kressler.
Aloha, thank you all for being here. I want to repeat what the governor has said. First of all, I think we're doing a terrific job of working on the dengue outbreak on Hawaii Island. There's only one potentially infectious case on the island today. Then, as the governor has said before, the number of cases and the frequency of the cases has been diminishing. So we feel very comfortable about the approach that we've been taking on Hawaii Island. And there have been no locally acquired cases of Zika in Hawaii. So we want to reassure our visitors and our citizens of Hawaii that it is safe to be here. We do want people to continue to fight the bite because it is the same approach for dengue and Zika or chikungunya or any other vector-borne disease to protect yourself from mosquito bites. So that again means getting rid of standing water in your yards, as well as wearing insect repellent and light long sleeve clothing. So we want our visitors to understand as well and to wear sunscreen to protect themselves from the sun. We need our visitors to know it is safe to come to Hawaii, and we want to help educate them about how to protect themselves from mosquito bites. So they need to wear repellent if they're in a mosquito-borne area. And also, the governor has already released some funds so that we are actively hiring new staff, entomologists that will be dedicated to Hawaii Island. That'll be starting next week, as well as additional communications and vector control staff. In addition, we're very appreciative of the support from both the governor and from the legislature to date. We are working on close to $2 million additional funds that we would like to have in the supplemental budget to rebuild our vector-borne disease division and our disease outbreak control so that we can keep Hawaii safe and make sure that the kinds of efforts that we're doing on Hawaii Island are available on all of the islands. And that's part of the reason for this today. There's no new emergency. It's the fact that we need to take this statewide in order to continue to protect our visitors and our citizens. Thank you.
Thank you. Also joining us this afternoon is George Segedi, CEO of Hawaii Tourism Authority.
Thank you. Thank you. Aloha and good afternoon, everyone. Thank you for being here. Really appreciate it. And I look around the room, I see a lot of the visitors, stakeholders. Really appreciate you all being here. And I see some of our policymakers. I want to thank them very much for being here as well. So on behalf of the Hawaii visitor industry, really want to thank Governor Ige. Thank you for taking this action. This is good news for our industry and for our visitors coming to Hawaii. I also like to thank a big mahalo to Dr. Pressler and DOH and thank them for guiding us through these times and as well as making it safe for Hawaii residents as well as our visitors. Safety, as you know, is always a top priority for us at the visitor industry. As I look around the room, I also want to say mahalo for, I can see in the room right now, we have joining us in support of this preventative measure, travel leaders representing North America. We have Japan, Korea, China, transportation, and activities, all in support of this action, of this preventative measure with the emergency proclamation. To Hawaii's travelers, I would like to, our valued travelers, I really would like to say there's no reason to be alarmed or to alter your traveling plans. No travel advisories have been issued. We're off to a strong start. All indications are we're off to a very strong start for 2016. And as you all know, taking priority, the top priority for our visitor industry is their safety, health, and welfare. And I think these measures will take care of that. Thank you very much. Mahalo. Thank you.
Thank you. We're open to take any questions that anyone might have.
Why wait until now to make the announcement?
It really wasn't about waiting. We have been discussing the appropriate time for the emergency declaration since the first case and outbreak back in October. You know, we have been working with County of Hawaii, making sure that we had the resources. We are getting ahead of the outbreak as discussed. You know, the fact that the president is seeking emergency funding and that the CDC has opened a level 1 operations center. Really, this action just allows us to prepare each and every county to take the proactive measures to fight mosquitoes, which will help us with the vector-borne diseases.
But the outbreak began in October, and there wasn't funding in the budget for increasing the staffing in vector control, which has been cut in half over the last few years. Why was that left out of the budget when the outbreak had began in October?
As you are aware, we were working with Centers for Disease Control, and Dr. Peterson had visited us in December. As you may know, the budget process actually starts in June, and so it wasn't an issue in June when the budget process started. We wanted to make sure that we had the advice and input from the Centers for Disease Control, and he had recommended a number of these items that we are having processed and we're proceeding forward with.
And let me add to that, when the dengue first broke out, what we did was we mobilized resources from around the entire state. It still is confined to Hawaii Island, and so we've done a good job of controlling the outbreak. At this point, especially Zika wasn't even on the horizon at that time, and it certainly wasn't an issue at the time of our budget. So the governor has released funds now so that we can staff up, so that we can backfill those positions on Hawaii Island and release the staff to go back to the other neighbor islands in Oahu. And we're asking for additional funds in July 1 in order to get those resources.
You mentioned one staff work coming on next week dealing with an entomologist. Can you talk about the other, what are the immediate plans for more vector control? We'll be filling 10 positions with the money that the governor has released. One is the entomologist, another is a communications person. That in fact has continued to be our most limiting factor, has been our communications capacity in order to get the word out to everybody and have everybody involved and fight the fight and know what they need to do to keep themselves safe. And then the other is a vector control staff.
All for the Big Island?
These will all go to the Big Island, and then that will free up the resources that we've loaned to the Big Island from Kauai and Maui and Oahu. so they can come back to their respective islands.
With a lot of the, I guess with Zika being a fairly new disease that population effects kind of still unknown, is the Department of Health here researching, are they prepping medical teams on what to look out for?
We are working closely with the Centers for Disease Control on the proper messaging to physicians so that we don't confuse anybody. This is something new for the CDC too. I think we're just learning about this disease, and so there's a lot of work going into how do we particularly inform pregnant women how to protect themselves, how to make sure that they have a safe pregnancy. Those things are still being worked out from CDC. So we are waiting actually to get some finalized messaging before we send out another physician advisory, because we don't want to confuse them, send one out today and then say, oh, here's some more information tomorrow. So we're trying to be consistent and make sure that we don't confuse them.
Any talks with the Department of Transportation in terms of air travel? I mean, how to monitor that coming in and out with, America, Samoa being so close, as well as some of the other travel advisory countries.
Yes, absolutely. Ford Fujigami is here, and he can address that if you like.
Ford Fujigami, Department of Transportation. The airport system has different protocols, basically depending on what the incident or what the appropriate action that needs to be taken. Being that we've been proactive and we've been monitoring this, I think you've seen all the posters that we put out throughout the airport system. Actually, in Kona and Hilo, we actually put out some mosquito repellent dispensing machines as well. So we're quite aware of it. We do have a physician that basically advises us in terms of what the special protocols are depending on what the incident is. So we're well prepared for this. It's just a matter of when an incident does occur, that's when we'll react to it. It would be kind of premature for us to kind of bring up anything until we actually know what's going to come up at a particular time.
Well prepared, but I guess concerns still, since this is a fairly new, just the Zika virus, effects are still hard to pinpoint.
That's correct. And that's the reason why we do have a physician that's basically a consultant to us. Again, we do have, as you well know, our own firefighters who are well versed in this. They react to all kind of medical emergencies as well at the airport. So they're being brought up to date in terms of what are the actions that's necessary to go ahead and take, should an incident occur.
Governor or George, what have you heard from the visitor industry, potential tourists coming? We heard your messages about reassuring visitors, but what are you hearing concern-wise?
So far today, we have had a little bit on the Big Island, as would be expected. We've had some cancellations on it. What I would say is that, and we watch it daily, is it has not to date impacted the rest of the islands. As you know, we're on pace already this first quarter to have a really good first quarter. Our bookings are very, very strong. I guess if we were to say anything, maybe those bookings might slow down. We've not had cancellations though for the rest of the islands.
Are there going to be any efforts
I
to
think
keep
Dan,
them?
one of the things and one of the reasons for doing this declaration at this time is really for us to be prepared and be pre-positioned. We don't want to end up waiting until we significantly impact the industry. We want to let the world know that we are taking action to reduce the possibility of vector-borne diseases here in Hawaii.
What kind of efforts will be made to get that word out besides this? Are there going to be any special travel advisory, not really an advisory, but just a way to reassure and some sort of PR or some way to get the word out?
Well, absolutely. That's why we have all of our contractors. We're working very closely with all of our contractors, North America, Japan, China, Southeast Asia. All of them are going to be in the loop constantly. We'll be putting out, keeping on track of it. As I said, so far, it's not become an issue. And I really applaud the governor and Dr. Preston what they're doing, because this allows us to get ahead of it. This really is preventative and allows us to get rid of some of the miscommunication and stuff going on, misinformation going out there. So we applaud this move. But so far, we are working very closely with all of our contractors on this.
What kind of headway is being made right now in just the dengue outbreak? I mean, is there positive movement?
As I had said before, that the number of active cases have been reduced and the incidents fewer and far between. But Dr. Pressler?
Are we still seeing, I mean, are they consistent in one area, or are we still seeing spots that pop up all over the island?
If you go to our website, we have a map that's updated every week, and you can see how that map has changed over time. If you go back several months, you'll see multiple hot spots that were very big. Right now, the only real red hot spot is Kailua Kona. So Milo Lee, for instance, was a spot where we got the entire community engaged and did a complete sweep of that area with all of the community there actively engaged, looking at all of the catchment tanks, making sure that there aren't any mosquito breeding there. And then Hawaii Civil Defense was back there again with vector control just yesterday, the day before, I'm losing track of which day, and went back again. This is like, several weeks later to reassess the mosquitoes and whether or not there's any mosquitoes in the catchment tanks, and making sure that everybody in the community is actively engaged in fighting the bite and helping to protect themselves. And there have been no new cases in Miloli'i.
Would you say the dengue outbreak is kind of prepping the state for if another mosquito-borne illness does make it to the islands here?
Ironically, I would say it has. We're prepared because it's exactly the same measures that we'll do for any vector-borne disease that we've been doing with dengue on Hawaii Island.
What about when, for example, a homeowner doesn't want their home sprayed? How does the state deal with that? If it's in a hot spot, what is the state required to do in terms of permissions to spray?
We've been trying to work cooperatively with members of the community. There are some who are holding out and not allowing us to be on their property. One of the things that this emergency declaration from the governor will allow us to do is that I can in fact enforce that we will come and take care of mosquitoes on property where someone is refusing, because it is a public health urgent.
Governor, some of your emergency proclamations have been described as declaring states of emergency. Can you address that in terms of this proclamation?
I think this proclamation is really about being prepared and making sure that we can position the state to assure that we can combat vector-borne diseases in each and every county. I mean, we have talked about the fact that we have refocused all of our resources to the Big Island during this dengue outbreak. As part of the evaluation by the Centers for Disease Control, that is one of the recommendations that they have made, is that we reestablish the vector program in each and every county, and then add the entomologists and other specialists and scientists that would help us continue to fight the bite and reduce the numbers of mosquitoes in our communities. So this really is a progression. It's an extension. It allows us to pre-position the state. If in fact the president is successful in getting emergency funding to fight Zika from the Congress, then we would be looking at what those funding opportunities would be and might be to allow us to be better positioned. I've been having conversations with the mayors and the civil defense managers in each county, and then we'll be talking about actions taken on the Big Island and how we want to ensure that every county begin to take the vector control activities, get out and turn over standing water and all of the other mosquito breeding opportunities, and really begin statewide to reduce the number of mosquitoes.
Going back to Zika virus, there have been some cases in Pacific Islands, including American Samoa. How much air traffic is there between Hawaii and American Samoa?
I don't have to answer
There's actually one flight. And what we do is, I gave the Department of Transportation Airport Division is more responsive. Basically, if there's anything that's identified on the aircraft, and then when they land, we'll respond to it. We'll take care of the needs of basically whether or not we should, contain the passengers on the aircraft and such. But we work in conjunction with the CDC. We work in conjunction with the medical teams as well.
One flight a day, Ford?
Yes. Thank you.
Any other questions?
Any other questions?
I have
qualified to ask a question, but, I live in Marshall Islands, and I get the Marshall Islands newspaper. There's report in the last issue that there's a possible beginning Zika outbreak in the Marshall Islands. So there will be any proactive stance to control access to life in the Marshall Islands if there is actually a Zika outbreak there.
I do think that we will obviously be monitoring the worldwide situation. This proclamation does allow us to get ahead of the game and pre-position assets. I do think that we have been working very closely with the Centers for Disease Control, and obviously, if they believe that any action is required on our part that we would again then look at it and take action as required.
Anything else? All set? Thank you, everybody.
Thank you, Governor.
Thank you.